Hello, everybody. This is Pastor Eric Lee from Springfield Baptist Church in Conyers, Georgia. I thank God for the opportunity to address you on this occasion, on this topic. We've been working so diligently this summer, trying to bring you back into the sanctuary here at Springfield Baptist Church. Over the last 6 weeks, unfortunately, we've seen a rise in coronavirus under the auspices of the Delta variant that is surging throughout our community. And when the new sicknesses are surging, the new transmissions are surging, the number of hospitalizations is surging, and we see evidence of that, and the number of deaths are starting to rise as well. And unfortunately, this portion of the pandemic seems to be most affecting those who are unvaccinated. We recognize that the vaccinations have been available now for about 8 months, and many of us have been reluctant and hesitant, and many of us have questions. We answered some of those questions about 6 months ago here at the Springfield Baptist Church when Dr. Barney Graham, a friend of my family, a former church member of mine, we were church members in Nashville, Tennessee. His office and his work has been instrumental in the development of this vaccination. And so there's no one else I trust more than Dr. Barney Graham. He comes as a personal reference from me to you. And back in February of 2021, he was right here at the Springfield Baptist Church answering your questions about the vaccination. I invite you now to listen to him. To those who are vaccine hesitant, for those of you who have family members that are vaccine hesitant, a great 100% of the hospitalizations and deaths that we're seeing now are among the unvaccinated. We can change COVID-19, but we've got to take the shot. And I want to urge you to do that. We are pro-vaccination here at Springfield. We surveyed our congregation and more than 85% of you have already been vaccinated. But the variants keep mutating because we have yet to reach that critical place where the great majority of us are vaccinated. I urge you now, get vaccinated, get educated, and share this video with your friends and loved ones who have been reluctant to take the shot. I pray that it's a blessing for you, and I pray that you take the steps to save your life and the life of the people you love. God bless you.
Well, this is a tremendous treat to be here at the Springfield Baptist Church. A few Sundays ago on Valentine's Day, I preached a message entitled Power Couple, and I shared a story about a power couple in the life of my wife and I, who've known us since the beginning of our marriage in the mid-90s. Drs. Barney and Cynthia Graham, who were members of our church there at the Metropolitan Interdenominational Church. Pastor Edwin Sanders, we praise God for him, and the Metropolitan Church is 40 years young here in the month of February. And one of the families that we got to know was the Barney family, and Dr. Barney Graham is a big-time doctor. At the time, he was working at Vanderbilt University. We babysat his children. We got to know them fairly well. Dr. Barney moved to Washington, D.C. to be a part of the National Institute of Health. And for more than 2 decades, he has been working on the protein that is the essential ingredient, if you will, of the vaccine. And for those of you who are wondering why I'm so comfortable taking the COVID-19 vaccine, it's because I know someone personally who is responsible for supervising and managing and the development of the COVID-19 vaccine. He is here with us today. And I'm grateful to welcome to Springfield Baptist Church, Dr. Barney Graham. Thank you for being with us today and agreeing to come on camera at such short notice to help us to make an informed decision about whether or not to take the vaccine.
Eric, it's so good to be here and to be with you and to see Ellis and Meek, the First Lady. And so it's my pleasure and honor to be here with you. And being in front of these cameras is a big surprise.
Yes, sir. Yes, sir. Thank you. I drafted him as soon as I saw him. So grateful. They live up in Rockville, Maryland, and visiting with family here. And that visit is what affords you the opportunity to stand in front of these cameras, to sit in front of these cameras with me today. So thank you. You helped to bring the COVID vaccine to fruition. So many people are reluctant to take the vaccine because they think it has been developed just too fast. We've seen so many vaccines that take decades to develop. Can you help us to understand that what appears to be warp speed really is not warp speed?
It's a long story, so I'll try to condense it. But one of the reasons I left Vanderbilt and came to the Vaccine Research Center at NIH 20 years ago is because it was founded to try to develop an HIV vaccine, which we really still need. And HIV has resisted our efforts to make a vaccine. We have not been successful making an HIV vaccine, but over these 20 years, the technologies that have been developed to try to make an HIV vaccine have resulted in solutions for a number of unmet medical needs and have been the basis for the response to a number of emerging infectious diseases that have been occurring over this last decade in particular, like chikungunya in 2012, and then the MERS coronavirus in 2013, and Ebola in 2014, Zika in 2016, Ebola again in 2018, and now we have a coronavirus that's new. And so these technologies that were generated through the efforts to make an HIV vaccine have been the basis for how we have solved another virus that I work on called respiratory syncytial virus, RSV. It's not a coronavirus, but its protein that attaches and gets it into the cell to start an infection is analogous to the spike protein on a coronavirus. So when we were able to solve the structure and find a way to make a vaccine for RSV, that was right when the MERS coronavirus story was happening in Saudi Arabia. And so we said, we're going to try to do this same thing for coronaviruses. And it took us 3 or 4 years to figure it out, but we finally got the structure of the spike protein in 2016. We learned how to stabilize it in 2017. After working with Moderna for a year in 2016 on Zika and finding out how good their mRNA technology was, we started a program with them in 2017 to work on both the coronavirus family of viruses and another family of viruses called the paramyxoviruses. And so that then led to the knowledge needed to immediately start a vaccine program on January 10th when the sequences came out from this new virus.
So again, we're talking to somebody who was in the lab, somebody who has been intimate with the process of the development of the COVID-19 vaccine, and the vestiges, the preliminary, the beginnings of this vaccine, you can date back 35 years when we were beginning to find or look for an HIV vaccination process. You mentioned that the spike protein was developed in 2016.
We found the structure. What I mean by the structure, if you look at these viruses, they're little spherical objects. They're 80 nanometers across. That means about 20 million viruses can fit on the head of a pin. That's very, very small. And they've got about 22 to 24 of these spike proteins that look like little knobs on the surface of this sphere. And we are able to take that protein, and using special techniques, we can look at this, the details of how that protein is folded to make what looks like a railroad spike. And we can see it down to the angstrom level, meaning the atomic level. So we can, if I could hold a spike protein in my hand right now, it would be a little bit bigger than the size of my fist, and that would be 10 million times larger than it actually is. But you can see the details of it. And the reason that's important, and that's what we had learned 7 or 8 years ago for RSV, is that when you make an antibody response, that's the part of your immunity that we're trying to generate with this vaccine. The antibodies see the shapes and the surfaces, the contours, how the shape of this protein is formed. It matters for the antibody. And so if you don't show it the right shape, you won't make the right antibody. And so getting this structure and then learning how to make changes in the protein to hold it together from the inside to save the outside surfaces, keep them the same. Learning how to do that occurred in 2017 for the coronavirus, like it did in 2013 for RSV. And since then, we've been learning how to deliver that with this new technology that called mRNA, messenger RNA, that Moderna had been working on for 5 years before that. Now they've been working on it for about 9 years. So we were trying to combine what we call precision vaccine design, precision vaccinology with rapid manufacturing. And that was our plan for pandemic preparedness. And so by the time this virus came, and then we learned it was a coronavirus on the 6th of January, I talked to the CEO at Moderna on the 7th of January. He said, as soon as you send us the sequence, we'll start manufacturing. We know what to do. The sequences came out on the 10th. We designed things on Saturday, the 11th of January 2020. And by the 14th, Moderna made the decision at risk, without really any funding yet, to start making the mRNA product. That we started studying in mice by the 4th of February. We solved that structure as well. We started getting information that it was working. We already knew that it would work for the other coronavirus, MERS. We'd already done those experiments. That's why they were willing to take this and manufacture at risk. And so within 41 days, they gave us back RNA that we could put into people, made in a clinical grade way. And so within 65 days of getting the sequence, we were starting phase 1 trials, which was our new record. So we really were able to get off to a fast start. But Moderna was a relatively small company at the time. And so without the big influx of cash and money from BARDA, the government agency who helps do things like this, they would not have been able to take this forward as quickly as they did. So we started that first study on March 16th. Well, the next day, March 17th, Pfizer decided they would buy BioNTech, which is an mRNA company in Germany. And I had been talking to their CEO in February about what protein I would use in his design. And so that company also is using the same protein sequence that Moderna is. So the Pfizer and Moderna vaccines are almost identical. The little mix of lipids that holds it together, that Dr. Kizzmekia-Corbett, who I think you see behind me, calls a little ball of fat, is maybe a little different chemically, but not much different. And so these two vaccines are very, very similar.
You are pretty much a big deal, aren't you? Just being able to call the CEO of Moderna and Pfizer.
Well, they called me, Eric.
They called you. Okay. Barney has always been an understated big deal. And I'm grateful because you being in those labs and being in those offices is going to give us an opportunity to have more confidence in what's being delivered. And essentially what you're saying is that the components of this virus did not get developed in 9 months.
Well, the concepts behind
January
it,
2020, it was already in development.
we started as soon as we got the sequences from out of China, and they were posted on the web. That's what allowed us to start the process on this vaccine. But the conceptual work behind this was, over many, many years. Part of the story of this vaccine is Dr. Corbett, Dr. Kizzmekia Corbett, who I've worked with for a little over 15 years now, since she was in high school. She was an intern and summer student in my lab, and then worked in the lab for a few years before she went to get her PhD at the University of North Carolina, and then came back to my lab in 2014. And her project was the coronavirus project. And so when we heard about this outbreak in China on the 31st of December, I texted her, or emailed her around 5:30 that morning when that news release came out, and I said, we need to keep our eyes on this. And so as soon as we got this, she has been central to the process of getting the work done, immunizing mice, developing assays, doing the work to really support the development of the Moderna vaccine. So our group, our lab, Dr. Corbett, has been very involved in this whole process, all the way through now, through the phase 3 trials that have been completed, and we now know that it works.
So it's still African American History Month 2021. Next month is Women's History Month, and chances are people are going to see this either in February or in March. And so Dr. Kizzmekia Corbett is the personality and the face of this new technology, this new vaccine. And tell us about the day that the nation's spotlight began to shine on her and to bring to the forefront what she's been doing in the background.
Dr. Corbett was the same person a year and a half ago that she is now. And but not many people knew that. A few of us knew that. But so on March 3rd, our 41st anniversary of 2020, the president, the 45th president, came to our laboratory to see what was happening on the vaccine development. He made a visit to our lab, and I decided that I wanted Dr. Corbett to be out in front on this. And so she and I both gave the presentation to him about what we were doing with the vaccine. But that publicity, that notoriety, that visibility that day has led to, and the work that she's done has led to her becoming quite a scientific celebrity. I think more people know her now than know me. And
you are completely all right with that.
I am.
Knowing you all these years.
I am so proud of her. She has managed the notoriety and the work and everything else along the way, and so I'm very proud of her.
And as we all are proud of her, and I want to just make sure that we address some of the reluctance that comes through the African American community to the vaccination. It causing Bell palsy, it not being tested widely enough, just all the fears, it being some government conspiracy to track us.
Let me go through some of these, because I've heard a lot, and I've talked to people a lot about these kind of issues. So first of all, you've heard that the reason this has gone fast is because of a lot of prior work, but also a lot of influx of cash from the government in order to make this feasible. And so instead of all these steps that have to happen in a serial fashion over a 10-year period of time, normally, it was all compressed within a year. And so the animal studies in mice and monkeys and hamsters and other things were compressed. The clinical trials that went from phase 1 to 3 were compressed and done in parallel, staged just in time, just with data just in time to support the next step. And so that was done because of the big influx of cash. So there's an explanation for why it was done so fast. And honestly, in 35 years of doing this kind of vaccine work, I don't think I've ever seen a more complete or solid, convincing data package on a vaccine, even when it's been taking 10 or 20 years to do. So I'm very comfortable with the safety profile and the way this vaccine works. Comfortable enough for my young daughter to be part of the Moderna phase 3 trial at UCLA, and I got to see her get her first vaccine on FaceTime, which was a joy for me, and enough for me to have my wife and family vaccinated. And so I am sure the vaccine is safe and well tolerated, and that it works. Now, the problem in the black community is that there are a lot of reasons why they should be hesitant. There's a lot of reasons why I would be hesitant as well. There's Tuskegee, there's Henrietta Lacks, and there's a whole series of other things that have happened historically, but there are also things that are happening every day, right now. Medical physicians, healthcare providers are making decisions right now that are biased toward many minority groups. And this is still happening. We've seen it reported on the news. We know that it's happening. There's scientific evidence that it's happening. And so there's a lot of reasons why I think it's reasonable to hesitate and ask the question. And so what we want to do is at least bring the information that we have and tell people what we know about the vaccine so that they can then make an informed decision. And I think that's what we can do. Now, if you're going to not trust the system, which is, as I said, it was reasonable, the thing you should be looking at is how the vaccine is being distributed. You need to make sure the vaccine is being distributed to people who want to take the vaccine. That's the place where you should have advocacy and awareness and scrutiny and oversight, because right now, even though some minority groups are hesitant to take the vaccine, there are a lot of people who want the vaccine who have not been able to get the vaccine. So I would pay more attention to the distribution. And I think as people see how this works over time, the hesitancy will go away and the confidence will grow. There are some other things that are said about the vaccine. People are worried that it might cause infertility. People are worried that it might change your DNA. People are worried about things like that. And so I know where some of those things come from. People are even worried that maybe you are being injected with some kind of tracking device. And I think that comes because of the size I was mentioning. It's a nanoparticle. I think people took that into science fiction language and decided that's like a nanobot, and nanobots are things in science fiction novels that could potentially track you. But this is not a nanobot. It's a nanoparticle, and it's a protein chemical, an mRNA that goes away within 72 hours. But the mRNA is a chemical that every cell in your body makes all the time, every day. It's one of the basic elements of life. Nobody is going to be alive if they don't have mRNA, because it's what is used to translate the DNA in your chromosomes in the nucleus of the cell it goes out into the outer part of the cell, into the cytoplasm, and then that code that's inscribed in that mRNA sequence is what's used to build your proteins. So proteins are based on the 3-letter code that comes out of the mRNA. So mRNA is everywhere. It's in all living things that I know of. And so when we make the mRNA that encodes the sequence of this spike protein, which is about 1/10 of the whole virus, so we're only giving this one protein out of the virus. So this mRNA goes into the outer part of your cell. It never goes into the central part of your cell, the nucleus. It's never getting into your DNA. It's not there with your DNA. It's in the outside part of the cell. It's translated into a protein. It stays there for 24 to 72 hours, and it's gone. It's the most elemental, simplest way of making a protein. And so that's how this vaccine is delivered. So it's not going to cause infertility. It's not going to change your DNA. And I think some of the terminology that we use, some of the jargon that scientists use, is probably why people think of these tracking things, but that's not going to happen either. There's really no way that I know of for that to be able to happen. And so there's a lot of mistrust and there's a lot of uncertainty, but I think everybody eventually has to make the decision, because in 3 to 5 years, everybody's going to have immunity to this virus. You're either going to get it through an infection or through a vaccination. And until everybody has immunity, there's going to be a risk of the virus circulating. There's a 1 or 2% chance of mortality with the infection. It's higher if you're older. And there's about a 20% chance or so of long-term symptoms. With the vaccine, there's about a 3 to 6 chance out of 1 million that you'll have a severe allergic reaction that can usually be effectively treated, all but one time that I know of. So you're talking about 1 or 2 chances out of 100 of dying, or 3 to 6 chances out of 1 million of having an allergic reaction that can be treated. I don't think that's a very difficult decision, but that's the decision I think people are going to have to make as we go forward, because everyone's going to be immune to this eventually.
And Barney, the irony of the people who are watching is you're married. You talked about how long you've been married. You just celebrated how many years?
Our 42nd anniversary is coming up on March 3rd.
March the 3rd, you will have been married 42 years to an African-American woman who went to Fisk University. And who is a bold, bald-headed black woman. And you have children.
You forgot the beautiful part.
and your daughter has been in the trials. And so you've got skin in the game. As a matter of fact, you've been...
My 3 children and my 8 grandchildren are African Americans.
Yeah.
I live in the African American community, so
You've been in the black churches for as long as I've known you.
I do have skin in the game here.
Yes, sir. And so you wouldn't develop something that would hurt that community. And I think that's what this whole interview is all about. Talking about Dr. Corbett, all of that is about helping reluctant people consider what it takes to take the vaccine. And as we're talking about your wife, who is also a medical professional, who works in behavioral sciences, she has not been vaccinated.
She has not been able to get her first dose of the vaccine.
You made the vaccine.
Yes.
It's
been a very frustrating process for me.
And so for people who have access to it, our message to them is simply, don't
turn it down.
Don't turn it down.
Please. I spend 3 or 4 webinars a week talking to minority groups about this issue and hoping that they can get the information they need to make the decision. And my greatest fear is that in a community where there's 3 or 4 times more coronavirus, where the hospitalization rate or the death rate is 3 or 4 times higher than this other community, that if you also have a lower rate of immunization than this other community, a year from now, the disparity is not going to be 3 or 4 times, it's going to be 6 to 10 times. My greatest fear is that a year from now, the disparity in this disease is going to be 6 to 10 times higher in the African American community. That just is something we should not let happen.
And we all have the power to do something about it through advocacy, through education, through churches like Springfield that are making vaccinations possible. I just want to say that on behalf of all the people who are receiving the vaccine at Springfield today, yesterday, in the future, no matter which brand you're getting, they all got their they all got the protein spike design through NIH. And
That's right.
eventually
Most of them.
from Moderna, and eventually the others.
All but
copied the same.
AstraZeneca. Everyone in the U.S. except AstraZeneca.
Except for AstraZeneca. So on behalf of all of these millions of people in this country and the billions of people across the world that are going to be impacted by your work, you mentioned that you felt like your entire life has been developed for this moment. Can you say more about the destiny that brings you to this project?
Well, there's just a lot of threads of my life that all came together in this one big event. And the interracial marriage, where this year has been as much about social justice as it has been about the coronavirus. That's a big thing. The work I did on RSV 30 years ago to figure out how to keep vaccines safe, that's been a big part of this project. All the structural biology work and figuring out how to make the protein in the right shape from RSV and now coronavirus has been all part of this work. The pre-existing relationships and partnerships we had with industry like Moderna ahead of time became part of this. And there was another set of papers we wrote on pandemic preparedness, this concept of prototype pathogen pandemic preparedness. That's been a part of this process. And so another part that we haven't talked about is that the byproduct of this kind of work and this kind of vaccine technology is you're also generating things that we would call a probe, a way to discover antibodies. So when you give a vaccine to a person, you want their body to make antibodies. Those antibodies will grab onto the protein and make it dysfunctional. They won't let the protein pull the virus into the cell. So we want the body to make antibodies, but you can also make antibodies in a building. You can make it in a factory, and you can just give the antibody directly. And so with some of the proteins we made early on, because of a 3-year collaboration we had with another company called Abcellera, we gave them some cells from a convalescent survivor and the probes. They sorted out cells, we screened antibodies, and we found the antibody we call MAB 555 that Lilly took forward and is now has an emergency use authorization for treating people with coronavirus. So their antibody bamlanivimab is now an available treatment. So if you are symptomatic, if you have mild coronavirus disease and you're over 65 or you're over 12 with a condition that might make it more severe, you could be treated with this antibody, and then that reduces the chance of you going to the hospital by 80%. So it's a way of treating coronavirus to keep it from progressing. So people should know if they have mild disease, they should not wait till it gets severe before they go to the hospital. They should go in, say, I have coronavirus, I want to be treated, because I don't want to go to the hospital. So a byproduct of this vaccine development has been the discovery and development of new antibody treatments.
The monoclonal antibodies.
Right.
Okay, for infusion.
Right.
Dr. Barney Graham, thank you again for your time. Thank you for your expertise. And